All right. For today's discussion, our first question is on lactic acid increases ventilation. Receptors responsible for these effects are present where medulla oblongata, carotid bodies, in the lung parenchyma, baroreceptors, etc. What does intravenous lactic acid do to the pH? Due to the pH of the blood.
It should reduce the pH.
Yeah, it's an acid, so it will reduce the pH. Basically, you are introducing an acid into the system. So that will trigger the carotid bodies. Okay, they are usually stimulated by um, carbon dioxide level, oxygen level, or pH level. Okay, so how do you manage a poisoned patient? As the next question. What are the principles of management of a poisoned patient? They include the following: intensive care unit for special cases, ABCs for supportive measure, use of antidotes, all of the above. Of course, every single thing there is important measure for the management. Okay. Yesterday we discussed acid-base balance, and we also discussed antidotes. So identify the incorrect match: iron salts, deferoxamine, beta blockers, glucagon, ethylene glycol, fluoxetine, organophosphate, phloridoxan. Okay, that makes sense. They also help you to know that it's the wrong answer because obviously fluoxetine, which is an SSRI. Please don't move anything. Who is this person? Harrison.
No, sorry. You can go to the back. Let me do it. Tell them nobody should enter for now. I want to start now. This is
fluoxetine is obviously an SSRI, so it doesn't belong there. So the question should be, what do you actually use to neutralize? What do you actually use to neutralize ethylene glycol? What's the antidote? So fomepizole is the antidote for ethylene glycol. You also use activated charcoal, and of course, if required, you do hemodialysis. You know, it's a more toxic form of alcohol, like ethanol, the one that's uh, is easily drinkable. Okay, yeah. Most of the absorbed lead in chronic poisoning is deposited where there is the hair, the nails, the bones, the liver. What do you think? Okay, usually deposited in the bones. Lead is so heavy, it can actually displace calcium from the bone. So if someone has chronic lead poisoning, they will tend to even have um, lead displacing the calcium that is supposed to be in their bones. So leading to its own challenges. So there's a question here that's testing your knowledge of a heavy metal. Measline is seen in poisoning with lead, arsenic, copper, bismuth. Who is this person that doesn't have a name? Can you introduce yourself? Because I don't like candidates that don't have names. You ought to put your name when you are joining the discussion. Can you unmute your mic and introduce yourself, or I'll remove you if I don't know you. This person, fellow Gister. I'll remove you. Bye. Put your name and come back. All right. So main lines are found in arsenic poisoning. Okay. So another poisoning related questions, but this one is giveaway because we've already discussed it copiously. Acute diazepam OD. What would you use? Acetylcysteine, oximes, adrenaline, flumazenil. Yeah, make sure you are not left behind. It's good that all of you know the answer. You heard of the word Amanita phenoides. As a species of mushrooms. So victims of mushroom poisoning with Amanita phylloides may die of acute tubular necrosis, cardiac standstill, raised intracranial tension, and acute hepatic necrosis. All right, so it's well known to cause hepatic necrosis. You don't eat wild mushrooms because you don't know if it could be fulminant and lead to something known as fulminant hepatitis. Another heavy metal question. Basophilic stippling in red blood cell is found in poisoning with mercury, lead, gold, cadmium. Which of the above? Okay, sled. So before I forget, that those me lines are actually found on the nails, just like some lines on the nails, and some other heavy metals can also cause it. But in that case, arsenic was the major culprit. Another giveaway, but you can have it. Drug of choice in paracetamol OD, penicillamine, amyl nitrate, and acetylcysteine, cholestyramine. What is cholestyramine used for?
Cholestyramine is a bile acid sequestrant.
Okay. Yeah. What about penicillamine?
The only thing I know about it is that can it can cause drug-induced lupus. That's what I know about penicillin.
Okay. It's an antidote for copper poisoning, lead poisoning, arsenic poisoning. So basically, it's heavy metals. So it chelates some of these things. Chelates some of the heavy metals like lead, copper, arsenic. Okay. So that's the major function. What's the chemistry student? What's this thing for arsenic? Okay. Okay. Another alcoholic question. IV ethanol therapy is the treatment of choice for poisoning with what? Formaldehyde, methyl alcohol, glycol, isopropyl alcohol. Formaldehyde is that chemical that is used for preserving stuff in the mortuary and related places, laboratories. So if you did dissection in your anatomy, you would have known the smell of formaldehyde. So imagine someone ingesting something like that. So actually, IV ethanol therapy is used for management of methyl alcohol. So it competes with methyl alcohol. Normally, this is going to through alcohol dehydrogenase will become converted to formaldehyde. This mouse, also known as formalin. Okay, so um, what this IV ethanol, which is basically alcohol, and I no believe say if you inject alcohol, but it's not like just to carry alcohol and inject. Okay, it's proper therapy. So what it does is to compete with the methyl alcohol for the alcohol dehydrogenase enzyme, thereby preventing methyl alcohol to be converted into other toxic substances like formalin and others. So option B is the answer. So which of the following is not recognized as nicotinic effects uh, of organophosphate poisoning? Fasciculations, flaccid palsy, lacrimation, muscle twitching.
Madam, I'm doing something. I'll call you back.
So basically, well, all of you are conversant with the answer, so no need to explain again. But on the what do you call it, parasympathetic channel, there is muscarinic receptors and there is nicotinic receptors. So nicotinic is majorly muscles, okay, while muscarinic is majorly smooth. Um, well, nicotine is majorly skeletal muscles, okay, while muscarine is majorly glands and smooth muscles. So like GI tract, anywhere you have smooth muscles and glands. Okay, of course, lacrimation is there's a gland involved, lacrimal gland of the eyes. Intake of 8 grams of PCM as a single dose may produce seizures, pancreatitis, cardiomyopathy, hepatic damage. So the next question again is on um, related to ingestion of methanol. So which is a recognized complication of methyl alcohol? I didn't post it. So blindness is a very common complication of methyl alcohol poisoning. So let me take a moment to go through the. If I tell you the substance, you tell me the antidotes. Okay, so we'll be going serially. People can see yourself there. Just when I say it, you unmute and say um, acetaminophen. What's the antidote?
N-acetyl cysteine.
Sorry, who is answering?
Camila.
Okay,
Mm.
N-acetylcysteine. Yeah, that's correct. Opioids like morphine, heroin, fentanyl.
Naloxone.
Naloxone.
Okay, who answered? Benzodiazepines like diazepam, lorazepam,
Lumazenine.
clomazone, methanol, and ethylene glycol. They are found in antifreeze. In case you see it in questions, what's the antidote?
Sodium bicarb. Not
We just discussed it in a question a few minutes ago.
the IV ethanol.
Fomepizole.
Fomepizole.
Fomepizole can be used. IV ethanol can also be used. Okay. Um, Supportive care like hemodialysis are also important, and of course,
Fomepizole.
yes, fomepizole is
Fomep-
the main one, but you can also use IV ethanol too. All right, organophosphate poisoning like malathion, sarin,
Pralidoxime.
ralidoxime. Atropine is also important because
Yeah.
of its anticholinergic effects. Um, Carbon monoxide poisoning.
100% hyperbaric oxygen.
Yes, 100% oxygen. Cyanide. Cyanide poisoning. Sodium thiol.
Hydroxycobalamin.
Met.
What?
Cobalamin.
There's
Hydroxycobalamin.
hydroxycobalamin, and there's sodium thiosulfate, sodium nitrate.
Yeah.
Digoxin.
Yeah.
Digiban.
Digibind.
Tigipapine.
Yeah, Digibine, Digifab.
Digiband.
That's
Digiband.
the same thing. Heparin.
Protamine sulfate.
Yes, protamine sulfate. Warfarin.
Vitamin K.
Vitamin K. And fresh frozen and plasma. There's also a place for proton ring complex concentrates. Iron.
Deferoxamine.
Yes. Beta blockers.
Glucagon.
Atropine.
Glucagon, not atropine. Calcium channel blockers. You can use glucagon in both beta blockers and calcium channel blockers. Additionally, for calcium channel blockers, you can use calcium gluconate and high dose insulin. Okay. Um, Tricyclic antidepressants. The first thing you will give the patient is sodium bicarbonate. Lead, arsenic, mercury.
Penicillin.
Dimecapro.
Yes, Dimecapro. Susima is also there, or DMSA.
Or penicillamine.
Methemoglobinemia.
Methylene blue.
Yes, methylene blue. Okay, so theophylline. Theophylline is used for asthma and so on, things like that. Beta blocker is antidote. They have tachycardia that can come with it. Anticholinergic drugs like atropine, diphenhydramine,
For what?
anticholinergic drugs including atropine, diphenhydramine, what's the
Physostigmine.
physostigmine,
Yes.
yeah, neostigmine and things like that. So it's different from 2-pan that is used for organophosphates. Isoniazide, there's a substance that if you want to prescribe isoniazide, you have to prescribe it with this substance.
Vitamin A.
Vitamin what?
Is it vitamin? No, sorry, it's pregnant. Is it pregnant or vitamin
Vitamin B6, that's pyridoxine.
A? B6. Sorry. B6. Sorry.
Sulfonylureas, glyclazide, glibenclamide, all the glees. Um, what do you use as antidote?
Is this glucose infusion?
What?
Glucose infusion.
Yes, you can use dextrose infusion or glucose infusion. Octreotide also has a role.
Octreotide.
Octreotide. So, um, of course, if someone has a snake bite, rattlesnake, pit viper, you look for the antivenom, Crotalide polyvalent immune FAB, CROFAB. So, at least you are familiar with all the different common antidotes. Okay, this question tests your deduction from what we discussed earlier. All are modalities of treatment for CO poisoning except hyperbaric oxygen, physostigmine, artificial ventilation, blood transfusion. As straightforward as parallel lines. Okay, going back to biochemistry. So you see a patient that has an enzyme deficiency. I remember mentioning that there are some triggers. So in GCPD, deficient subject, ingestion of which of the following may produce hemolysis? oxalic acid, phenol, salicylate, naphthalene. In the common parlance, what do we call this naphthalene? You have to relate your medicine to outside medicine. What do you call it? What's it called in common parlance in Nigeria?
Is it not
Those
camphor?
white
Yeah,
balls.
it's camphor.
Yeah, camphor.
Naphthalene
Camphor.
balls. Okay. So someone who has GCPD should not go near camphor. What are the other triggers of GCPD attack?
Fava beans.
Yes.
Sulfonamides. Sulfur containing drugs.
Okay.
Drugs like lipoprotein.
So you can see it on the screen. If they ask you a question, think of how you can classify whatever you want to say. It makes it easier to answer. So there are medications, there are foods, there are infections, there are other triggers. Okay, so think of it that way. You easily be able to produce a lot. Okay, sulfonamides, sulfur containing medications have interaction with a lot of allergies. Um, what's this? Toxic epidermal necrosis, things like that. There's a lot of allergies to this sulfonamides, so always expect it. Primaquine is also like um, an anti-malarial. Okay, cephalosporins, quinine is also another anti-malarial that has high trigger. Fava beans, um, cruciferous vegetables like broccoli, cauliflower, Brussels. You may not be familiar with these ones, but United States they chop am. Okay, they chop am like oha. So fish and seafoods. Okay, there are some things like that, especially the raw on undercooked seafoods. It can trigger HCCPD. Infections, of course, malaria, just like a sickler, right? Uh, Infections with bacteria, infections, any type of infection, even dehydration, stress, surgery, exercise, all these things can trigger emotional instability. When they receive heartbreak, they start hemolyzing. All right. Um, when you use atropine for a patient, that state is called, and the person, uh, and the atropine starts working, that state is called atropinization. So, what are the signs that atropinization has occurred. Dilated and reactive pupils, rise of surface temperature, dry mouth, tachycardia. Yes, of course. Atropine is an anticholinergic, which means it's going to act like it's going to produce an adrenergic response, okay, which is to cause pupillary dilatation. And they do that because they want to be able to look into the eyes without obstruction, look into your retina and all that.
Chief, no, I well, I'm in online class. I told her that I'll call them once. I told you I'll call them.
An increase in dead space will be expected with
I used
which
to
of
do
the
that.
following?
I used to. I told this guy I used to do it since. Ever since.
Pulmonary embolism, atelectasis, bronchoconstriction, and obesity. Causes pulmonary embolism. Okay. This is something I taught you guys yesterday. Now here is a question on it. Oxygen saturation curve is shifted to the right by all except increase in hydrogen concentration, decrease in temperature, increase in 2,3 diphosphoglycerate, increase in PCO2.
So, if you put
So we mentioned that the things that shift the curve to the right are things that, you know, the right is right for the body. That's how I look at it. So um, an increase in hydrogen ion or a decrease in pH, a decrease in oxygen level, or an increase in carbon dioxide level, an increase in temperature, okay, or an increase in diphosphoglycerate. So the reason is that diphospho, this 2,3-DPG, um, has higher affinity for like oxygen. So when it does that, it shifts it to the right, like telling the body that oxygen is not enough. So a decrease in temperature will shift the curve to the left. That's increasing affinity of the red blood cells for oxygen, or the hemoglobin to oxygen. Obstructive lung diseases, all except pulmonary fibrosis, asthma, emphysema, bronchitis. Yes, I mentioned someday, I think it was day one or day two of our discussion, that um, there are two types of lung disease: restrictive and obstructive. So you have to learn how to differentiate them so that um, when you do when you do spirometry, okay, you calculate this. So you now use this as the metric to determine whether the lung is obstructive or restrictive, even before you do a chest X-ray. Right. So if it's obstructive, you expect this ratio to be on the low side. Okay. Normal, you expect for normal individuals 70 to 80%. So if you get something that is less than 60% or 70%, you consider it an obstructive lung disease. So things like asthma, emphysema, chronic bronchitis, they are obstructive. Okay. Then things like pulmonary fibrosis are restrictive. So it will cause restrictive lung disease will cause a normal or even increased um, FEV1 over FVC ratio. All right. Okay, another question still on this. I also remember showing you an image of this inspiratory capacity. FRC plus IRV, TV plus IRV, TV plus RV, FRC plus RV. What's IRV and what's TV? It's not television.
Tidal volume and inspiratory reserve volume.
Yes. So yeah, you sum that up to get the inspiratory capacity. Inspiratory reserve volume is like the volume of air. What's that again? Like um, when you do your maximal inspiration, well, that one is reserve volume, like expiratory reserve volume. When you like between tidal volume and extra maximal inspiration, that extra air you're going to take in, that's called the inspiratory reserve volume. And when you sum up that extra air plus the normal tidal volume at rest to give you the inspiratory capacity, which makes sense. So the expiratory capacity will be tidal volume plus expiratory reserve volume, which is like the normal reserve volume that we mentioned. Which of these is false?